You might have come across a photo of an uber muscular cattle, such as this Belgian blue shown here. This particular breed of cattle happens to be deficient in a protein called myostatin. Myostatin is a protein found in many cells, but almost exclusively in the muscle, and are released upon damage to the cell. Myostatin has two important roles. First, it stimulates fibroblast proliferation that induce fibrosis, aka scarring. And second, it inhibits satellite cell proliferation and differentiation, aka myogenesis. Blocking myogenesis limits protein synthesis potential as well as regeneration capability of muscle after injury. Remember that satellite cells are needed to fuse to existing muscle fibers with the help of IGF-1 to increase the myonuclear content to fiber ratio needed for muscle protein synthesis. So what's the significance of having a myostatin gene? Aside from myostatin's role in fibrosis or scarring, muscles are very metabolically costly to maintain. To be metabolically efficient, our bodies can either upregulate myostatin, depending on the need for less muscles, like during sedentary periods, to decrease metabolic requirements from having to maintain big muscles. Or it can downregulate myostatin if we need more muscles, such as muscle adaptations from stress or training. Why is it important for us to have a way to regulate myostatin? In the pharmaceutical industry, having a commercially available myostatin blocking drug seems very lucrative to address a wide range of health conditions like muscle wasting diseases such as ALS, muscular dystrophies, and inclusion body myositis, sarcopenia, which is the age-related decrease in muscle mass, cachexia, which is cytokine-mediated degradation of muscles, such as seen in cancers, congestive heart failure, COPD, and chronic kidney diseases. They can even include possible markets for bodybuilders and fitness enthusiasts. It makes financial sense for Big Pharma to develop such a class of drugs, and I think it can be safe to assume that there's no lack of trying. However, in rehabilitation, it makes sense that we would want to down-regulate myostatin for our patients, so that the resistance training we are giving them in the clinic is giving them actual benefits of building muscles and strength. Studies have demonstrated a down-regulation of myostatin after weeks of heavy lifting, which is correlated to increase in muscle strength and hypertrophy. But that's heavy lifting. Consider a patient who is injured or post-surgery. These patients cannot exercise at a high intensity, and yet they are at a higher risk of losing strength and muscle mass. And by the way, if our patients can carry out casual conversation while performing resistance exercises without batting an eyelash, or are too busy looking down on their smartphones, can we really say that they are exercising at a level that can stimulate muscle adaptation? Food for thought. A study measuring myostatin markers comparing a high-intensity resistance training group with a low-intensity resistance training group with BFR and a low-intensity resistance training group without BFR found that after 8 weeks of training, only the BFR group and the high-intensity training group demonstrated a significant reduction in myostatin, as well as significant increase in muscle cross-sectional area and strength. As we've learned from previous videos, BFR can bridge the gap between low-intensity and high-intensity exercises by providing a significant training stimulus or signal through metabolic stress for our bodies to activate multiple repair and growth pathways. And now, as we've just learned, it can also help down-regulate myostatin. For more information, I go to owensrecoveryscience.com. There is where I find any relevant information regarding the use of BFR for my clinical practice. There, you can also find BFR certified clinicians near you. If you want to see more videos and information about BFR training, please leave a comment and check out my other videos. And don't forget to click the like and subscribe buttons. Thank you for watching.